One introduction. ROSEP view: the United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only. For home building and furniture building, for just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions, yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry, and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable, wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree, but it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut-down and burned tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lungs, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom, the Eco-Design Wood Stove, and International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. ROSEP view: purple air PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.
Hi, my name is Lily. Andrew gave you the intro to Residents Against Wood Smoke Emission Particulates and their concern for air pollution from indoor residential wood burning. Residents Against Wood Smoke Emission Particulates, or ROSEP, would like every near neighbor of an indoor residential wood burner whose wood smoke enters their yards and sickens the near neighbors to have a purple air PM 2.5 monitor hanging from the eaves of their home to measure the level of PM 2.5 entering their yards. That measurement of air pollution should be used as evidence of unnecessary air pollution, and each indoor residential wood burner should be shut down based on that evidence, one indoor residential wood burner at a time if necessary. The presentation by Andrew ended at 2 minutes 5 seconds. The same presentation by Emma starts at 2 minutes 3 seconds before the end of this podcast. So I am Lily, your timekeeper, and you can start the next podcast at 2 minutes 5 seconds in if you would not like to see the presentation by Andrew a second time. This presentation by me, Lily, ends at 5 minutes in. What you will see in the main content of this ROSEP podcast will be news about air pollution from indoor residential wood burning, and how that air pollution is being combated by ordinary people just like you who are unfortunately near neighbors of indoor residential wood burners at this time. There will also be news about unnecessary and highly polluting use of wood as fuel in industrial wood burners and preventable air pollution from wood burning wildfires. There will also be news about air pollution from PM 2.5 from gas-powered cars. There will also be news about airborne diseases which are also preventable with vaccines such as COVID-19 and measles and whooping cough, to name just a few. In 2025, Residents Against Wood Smoke Emission Particulates is also concerned with combating the Trump destruction of government funding for programs which protect human health through the Department of Health and Human Services, and Trump destruction of programs which fund the science and medical research plan to protect human health from preventable illnesses. Protecting human health is a patriotic act, and our defense against enemies is weakened if we are not as healthy as we can be. Heat pump rebates are now offered by the federal government, distributed through the eligible United States, are available in 2025, and are the best, cleanest, and now cheapest alternative to indoor residential wood burning if that burning is actually done to purportedly save money. Wind and solar as sources of the electricity that powers heat pumps and electric cars is also cheaper than burning wood. The adverse health effects that are caused by indoor residential wood burning also come at a cost to near neighbors, both in shortening and ending their lives, and in actual hospital, clinic, and funeral costs. Instead of being compensated monetarily, near neighbors should instead be able to achieve immediate relief by stopping indoor residential wood burning in their hyper-localized neighborhoods, which relief readings from purple air PM 2.5 monitors used as evidence of air pollution will help them achieve. Welcome to news about hopeful scientific and medical achievements that will also help us achieve the goal of clean air to breathe.
Episode 57 DHWY June 27, 2025 Recap Kennedy Jr. Vaccine Policy Meeting of Anti-Vaccine Advocates. In Episode 57 DHWY1 on Medicine Debriefing, after the June 25, 2025 Kennedy Jr. Vaccine Policy Meeting of Anti-Vaccine Advocates 2 Thimerosal containing vaccines and autism. This report was compiled by scientists and medical doctors and shows no association between vaccines and autism. After reviewing the evidence, 3 Your Local Epidemiologist Recap of the Kennedy Jr. Vaccine Policy Meeting of Anti-Vaccine Advocates. Main content. 1 Inside Medicine, the RFK New Vaccine Committee has voted. Now what? Debriefing and looking ahead. Excerpts edited by Rozep for brevity and clarity and relationship to residents against wood smoke emission particulates. A 501c3 nonprofit organization on medicine. Video transcript. Some adjectives came to mind while watching the meeting: surreal, embarrassing, Kafkaesque. In place of 17 highly respected voting members, all fired by HHS Secretary Robert F. Kennedy, were 7 new characters whose opinions ranged from unhinged, several of the members, to reasonable, mainly voiced by Dr. Cody Meissner. Various members asked questions that revealed incomplete understandings of the legal process around these votes. One member was not sure whether or not she had a conflict of interest. Random conspiracy theories got airtime, while vetted scientific materials created by CDC scientists were literally removed from the website of the meeting after having been posted earlier in the week. Indeed, we learned during the meeting that the CDC briefing document on the safety of Thimerosal and vaccines was removed because RFK Jr. himself did not approve of it. That, of course, means that the error-ridden cherry-picked data in another presentation on the topic by an outside speaker, a longtime RFK Jr. ally, was approved. It was a dystopian nightmare. The quasi-good news is that the committee voted in favor of flu shots for everyone ages 6 months and up. They also voted to add a second RSV immunization option. Here are those recommendations lightly adapted from CDC language: 1 dose of clesrovimab, a monoclonal antibody for infants whose mothers are not protected by maternal respiratory syncytial virus RSV vaccination. Clesrovimab is one of 2 RSV monoclonal antibody products available, including for the Vaccines for Children program. Routine annual influenza vaccination of all persons aged over 6 months who do not have contraindications. The bad news is that the committee also voted to recommend that influenza vaccines that use Thimerosal, a safe preservative in relevant concentrations, not be used. This will not do anything to improve vaccine safety, but it did escalate pseudoscience to national policy. This is remarkable. In every previous ACP vote, comprehensive data has been presented before a vote. In this case, one friend of RFK Jr. gave a talk whose contents were not vetted or fact-checked by CDC scientists before a national vote. It also may eventually be used as a rationale for denying vaccines to people around the world because preservatives are needed to keep multi-dose vaccine vials from becoming contaminated, especially in settings where the chain of refrigeration may not be complete. Also, the CDC-owned experts were not permitted to speak on this, nor was their briefing document permitted to remain online. My heart goes out to the dedicated CDC scientists who had to sit through this. Here is a screenshot I took during the meeting yesterday during the Lynn Redwood Wright unvetted, highly problematic presentation on Thimerosal. That poor CDC scientist left looks like a hostage. The committee undermined vaccine confidence by scaring people about Thimerosal. Also, the notion that the proceedings were transparent or expansive simply was not borne out by the facts. This committee specifically suppressed work by CDC scientists. It also failed to publish the language of national vaccine policy votes in advance, which is probably illegal, claiming all of these virtues as though they were innovations while actually undermining them by turning away from the prior genuine commitment of the committee to those principles is what the kids call gaslighting some resources with actual science and debunking. Below are 2 documents that fact-check the ACIP meeting. They were created by a trustworthy group of scientists and health influencers and debunked dozens of lies propagated by the new ACIP panel. Also, because I anticipated that Secretary Kennedy might remove the rigorous briefing document on Thimerosal from CDC scientists from the ACIP website, which he indeed did. I downloaded a copy of it right away. Secretary Kennedy literally does not want you to see this. As per above, that is not hyperbole. We learned at the ACIP meeting from the chair that this document created by CDC scientists was not approved by the Kennedy Jr. office. So here it is. Read it, share it. Thimerosal containing vaccine summary of evidence. The ACIP meeting was a bizarre spectacle. It was as bad as feared, if not worse. Reasonable science from CDC experts was presented side by side with debunked misinformation presented by RFK allied anti-vaxxers. Other times, only one side, the unscientific side, was permitted to present. What we witnessed was a circus masquerading as dignified proceedings. While mostly the whole thing would be hilarious, but for the stakes, lives are on the line. Scientific integrity is under attack. Transparency is now just a buzzword to stand in for a newly discovered opaqueness from this once august committee, whilst it claims the opposite. Once again, I urge Senator Bill Cassidy, a physician now being routinely humiliated by his vote, to confirm Secretary Kennedy, based on false promises, to stand up against this attack on science of the RFK Jr. sudden removal of all 17 voting members of the CDC previous vaccine advisory committee on June 10, 2025. I do not even know where to start. The meeting of the new committee on June 25, 2025 was like watching Fox in a henhouse. 2. This report was compiled by scientists and medical doctors and shows no association between vaccines and autism. After reviewing the evidence, Thimerosal containing vaccines and neurodevelopmental outcomes. Review of the evidence. Excerpts edited by Rozep for brevity and clarity in relationship to residents against wood smoke emission particulates. A 501c3 nonprofit organization. Your Local Epidemiologist, June 27, 2025. Thimerosal is an ethyl mercury containing compound that was used for decades in the United States as a preservative in multi-dose vials of vaccines and other products to prevent growth of harmful microbes such as bacteria and fungi. Under the FDA Modernization Act of 1997, the FDA conducted a comprehensive review of the use of Thimerosal in childhood vaccines. This review found no evidence of harm from the use of Thimerosal as a vaccine preservative other than local hypersensitivity reactions. Thimerosal and vaccines. FDA in 1999 with input from the Public Health Service and other partners. FDA requested all vaccine manufacturers for plans to remove Thimerosal from vaccines. this was taken as a precautionary step, not due to evidence of harm, to reduce the overall exposure to mercury to infants, given that other environmental sources of mercury were challenging to eliminate since 2001. All childhood vaccines licensed and recommended in the United States have been thimerosal-free, with the exception of some multi-dose formulations of influenza vaccines. Several vaccines used in the United States, for example MMR varicella, inactivated polio pneumococcal conjugate, have never contained thimerosal. During the 2024-2025 season, 96% of all influenza vaccines in the United States were thimerosal-free, and 98% of federal vaccines procured through the Vaccines for Children, or 317 program, were thimerosal-free. Source: CDC Immunization Services Division. A recent analysis from CDC Vaccine Safety Data Link showed that the proportion of pregnant women receiving a thimerosal-containing flu vaccine has decreased over time, with only 0.3% of doses administered in 2024 containing thimerosal over the past 25 years. Multiple, well-designed studies using various epidemiological study designs have been conducted in several countries, evaluating a potential association between thimerosal exposure and autism spectrum disorder (ASD), other neurodevelopmental disorders, and cognitive functioning. Data from CDC Vaccine Safety Data Link (VSD) showed that there was no increased risk of ASD from prenatal or early life exposure to thimerosal. Price et al. 2010, or from increasing number of antigens from vaccines up to 7 to 12 and 24 months. Iqbal et al. 2013. Similarly, in a nationwide cohort study of all children born in Denmark from 1990 to 1996 numbering 467,450, risk of autism and other autistic spectrum disorders did not differ between children vaccinated with thimerosal-containing vaccines and those with thimerosal-free vaccines. RR 0.8595%, CI 0.61.20. Some studies that evaluated performance on over 24 different tests of neurodevelopment did show a few significant associations between cumulative thimerosal exposure and on some tests of specific neurodevelopmental functions. However, these were few and not seen consistently across similar tests or across studies. Thompson et al. 2007, Tazi et al. 2009, Verstraeten et al. 2003, Heron et al. 2004, Andrews et al. 2004. Meta-analyses suggest no relationship between thimerosal and autism or mercury and autism. Taylor et al. 2014, Yashimasu et al. 2014. Furthermore, the Institute of Medicine, now known as the National Academies of Sciences, Engineering, and Medicine, examined evidence evaluating the possible association between thimerosal-containing vaccines and autism in 2004, concluding that studies consistently provided evidence of no association between thimerosal-containing vaccines and autism. Immunization Safety Review. Vaccines and Autism. The National Academies Press several non-CDC studies evaluating data from the VSD and the Vaccine Adverse Event Reporting System (VERS) identified an increased risk of autism and neurodevelopmental disorders with thimerosal-containing vaccines. These studies have significant methodological limitations, including unmeasured confounding, inaccurate assessment of exposures, differences in control and case groups, unverified diagnoses, and other potential biases that threaten the validity and reliability of the findings, considering the breadth of evidence and consistency in results. From multiple population-based studies conducted in several countries with various study designs, the evidence does not support an association between thimerosal-containing vaccines and autism spectrum disorder or other neurodevelopmental disorders. 3 Kennedy Jr. Vaccine Policy Meeting of Anti-Vaccine Advocates. Vaccine Policy Meeting. The Essentials, Foxes in the Hen House, and Rising Above the Noise for Fall. Excerpts edited by Rozep for brevity and clarity in relationship to Residents Against Wood Smoke Emission Particulates, a 501c3 nonprofit organization. Your Local Epidemiologist, June 26, 2025. This week, the Advisory Committee on Immunization Practices (ACIP) held its first public meeting since the new HHS Secretary, an outspoken vaccine skeptic, replaced all 17 members. More than 4,000 people tuned in, a level of attention not seen since the height of the pandemic. That is because ACIP decisions have a profound weight in shaping vaccine policy in the U.S. They determine which vaccines are recommended for whom, if insurers cover them, and when they are available. The June meeting is especially important as it sets the groundwork for the fall respiratory virus season. Insurers finalize coverage, clinicians place orders, distributors ship doses, public health communicators prepare messages. Disrupt this system or timeline, and the entire system falters. Here are the essential takeaways from the meeting. Bottom line up front: flu shots are recommended for everyone over 6 months. However, flu shots containing thimerosal 4 to 7% of supply are not because of scientific evidence, but because of falsehoods. RSV protection is recommended for pregnant women. Vaccine infants monoclonal antibody up to 18 months old and older adults. Vaccine this fall. A second monoclonal antibody option will be available for parents, which is good for kids up to 8 months old. COVID-19 will be available, but for whom, when, and what are still big questions. There was no vote, no guidance today, and there should have been inside the meeting. Foxes in the Hen House. This meeting followed the usual format. CDC scientists presented data, and the committee discussed, questioned, and voted on certain policies. This meeting undoubtedly demonstrated the high competence of CDC employees who were thorough, thoughtful, and well prepared. They answered questions with precision and demonstrated deep expertise. I continue to be incredibly impressed with this group. For the new committee, it was clear that not all were vaccine experts. They questioned basic epidemiologic methods, misunderstood fundamental scientific principles, and repeated conspiracy theories that have circulated for decades. At times, CDC scientists were educating them on how vaccine trials work, what the immune system does, and how the approval process functions. This is, of course, acceptable for a curious member of the public. It is absolutely unacceptable for people determining vaccine policy for 330 million Americans. Additionally, many committee members clearly began with conclusions and then attempted to force the evidence to fit. This is called policy-based evidence making, not evidence-based policy making. It is backwards. There is no new evidence or data to change recommendations. In fact, the committee removed documents that CDC scientists had posted. They stated procedure reasons when asked, but presumably because it did not support their foregone conclusions. This is not demonstrating radical transparency, and although the committee has disclosed conflicts of interest as it has for the past 70 years. HHS cannot pretend that pharmaceutical companies are the only conflict of interest. Selling supplements, profiting from medical litigation trials, and holding a leadership position in anti-vaxxer advocacy groups are all conflicts of interest. None of that was disclosed. We fact-checked the proceedings in real time and encountered more than 50 falsehoods. Wiley and others compiled 3 briefings on these falsehoods in near real time for leaders, communicators, and media. Feel free to download, use, or just view if you have questions about some falsehoods brought up. There were a lot. Get the briefs here. https www.evacollective.org. Tech briefs focusing on the science. It is easy to get caught up in the absurdity, and to be clear, much of it was absurd, but in the respiratory virus season is just around the corner, and that matters more as lives are at stake. The CDC presentations were strong, and the science behind them was solid. I am confident that despite the chaos, the data shared was not influenced by RFK Jr. or this new committee, so I wanted to walk you through that science, what we know, what protection options will be available this fall, and what questions remain, because at the end of the day, Americans deserve to be informed and empowered to protect themselves and their communities. COVID-19 vaccines. COVID-19 remains a serious health threat to Americans and a huge burden on healthcare systems. Last year, hospitalizations for COVID were similar to flu, and the flu season was the worst we have seen in past 15 years. Infants and older adults continue to be most affected. This is why it is so important for pregnant women to get vaccinated. Infants cannot get the vaccine until they are at least 6 months old, when maternal antibodies wane and their immune system is more mature. Source: CDC. Annotated by Wiley. Last winter, COVID-19 vaccines provided 30 to 40% additional protection against urgent care visits regardless of age, compared to people who did not get the COVID vaccine, and 40-70% additional protection against hospitalizations and ICU stays. Interestingly, protection is not waning as quickly nowadays, remaining stable up to the study period 180 days. Source: CDC. Annotated and read by your local epidemiologist. COVID-19 vaccines also continue to be safe based on the many systems the U.S. federal government has in place. Myocarditis, inflammation of the heart, is no longer a safety signal like it was for the first 2 shots of mRNA. Among adolescent boys who did get myocarditis from the first 2 doses of the vaccine, 91% have fully recovered. Votes. Usually the ACIP votes for COVID-19 vaccine eligibility for fall. However, this was taken off the agenda at the last minute for an unknown reason, so there was no vote. This means we do not know what the recommendations are for this fall. See more below in next steps. RSV protection. RSV is among our most burdensome respiratory viruses, particularly for children under 5, so it was an absolute game changer when not 1 but 2 options of protection became available 2 years ago for the first time ever. 1 vaccine for pregnant women who pass antibodies to their infants, and 2 monoclonal antibody for infants, not a vaccine but provides antibodies in the short term. We have already seen a decrease in the burden of RSV in healthcare systems as shown below. Source: CDC. Annotated by your local epidemiologist. In red presentation showed that both continue to be incredibly effective in the real world. Maternal vaccination, 70-79% protection against infant hospitalization. Monoclonal antibody called Nirsevimab, 79-82% effectiveness against infant hospitalization. Both options are also very safe and much better than the disease itself. There is one small but true safety signal. Scientists are looking closely at people who get the pregnancy vaccine have a slightly higher rate of gestational hypertension and preeclampsia. This could be due to data or other factors, such as women who are pregnant for the first time. Scientists are still investigating this. However, the benefits of the RSV vaccine still significantly outweigh the risks. This fall, we will have a third option, a new monoclonal antibody called Clesrovimab, approved by the FDA recently. It works about as effectively as the monoclonal antibody introduced last year. It does wane quicker, so it may not protect as long, but it is enough for 1 entire season. Having another option is good because lowers cost through competition, better access with more choices, slightly different virus target, which is good if the virus mutates. The downside is that it is not for 8-19-month-olds like the other one, so providers have to stock both, which is a pain. Votes. The majority of members voted in favor of the monoclonal antibody, meaning it will be available to the public. Flu vaccines. Last flu season was really bad, the worst in the past 15 years, and last season vaccinations continued to prevent a ton of disruption. Last year, it is estimated the flu vaccine prevented 12 million symptomatic infections, 240,000 hospitalizations, but the big point of discussion during the ACIP flu section was Thimerosal. Lynn Redwood, a former leader of Children Health Defense and Anti-Vax Advocacy Group, presented data. In short, it absolutely flooded the zone with cherry-picked data out of context. It also had fake citations, likely due to the use of AI. External presentations like this one typically need to be fact-checked by CDC. Typically, this occurs days or weeks in advance of ACIP meetings. It did not happen this time. There was one sane person on the committee who said, "I do not know where to start with all the falsehoods presented," and followed up by saying there is no scientific evidence that shows the harm of Thimerosal. I agree, we debunked many falsehoods in this brief. In real time, here are the facts. Thimerosal is an ethylmercury-based preservative that keeps vaccines safe from bacterial contamination. It was largely removed in vaccines in the United States in 1999 as a precaution, even though no harm was ever demonstrated at the time. There was no specific data on ethylmercury toxicity, so safety assessments conservatively applied the limits of methylmercury, the toxic form of mercury found in fish that many of us are familiar with. Using those stricter benchmarks, cumulative exposure from the full childhood schedule slightly exceeded what was considered safe for prenatal methylmercury exposure. Since then, numerous studies have demonstrated that ethylmercury is metabolized differently and is safe at the levels used in vaccines. In the United States, Thimerosal is only found in multi-dose flu vaccines, and trace amounts are found in TDVax, a tetanus and diphtheria vaccine for people aged 7 and older. Thimerosal is still used in other parts of the world as a vaccine preservative. Thimerosal and the use of multiple vaccines are incredibly important for pandemic preparedness. Votes. The majority of ACIP members voted to remove flu shots containing Thimerosal. This means about 4 to 7% of the flu vaccine supply will not be used. This is not a huge deal, but it may rippled out globally, which would have a significant impact because many global vaccines still contain thimerosal, and the groundwork here is what is most concerning for future vaccines. What is next for fall season flu and RSV vaccines will be available for the fall respiratory season. COVID-19 vaccines should be too, but major questions remain unanswered. Who will be eligible to receive them? Will people have to pay out of pocket, or will insurance and federal programs cover them? What are states legally allowed to do if ACIP does not make recommendations? Manufacturers are making vaccines right now based on formulas from last year because HHS recently required them to do placebo trials, which is not feasible and unethical to update it. However, there is considerable confusion around eligibility. I expect we will soon see the formation of professional society-led recommendations or even a shadow ACIP to fill the vacuum. It is time for the broader health ecosystem, payers, providers, health systems, and states to step up. Americans need a coordinated, unified front to ensure they have clear information, reliable access, and the confidence to make informed decisions to protect their health, their families, and their communities. On that front, we are off to a promising start this week. One AHIP and the Alliance of Community Health Plans affirmed their commitment to covering fall vaccines, ensuring patients are not left with unexpected costs. To the American Medical Association and nearly 80 professional organizations issued a strong joint statement. They will continue to follow and promote evidence-based vaccine recommendations regardless of political interference. 3 communication experts and trusted messengers are mobilizing to combat confusion, clarify facts, and support local decision-making, especially in the absence of consistent national messaging. This is progress. However, we need more unified voices and stronger commitments across the system, particularly from governors, employers, pharmacy chains, and community organizations. If we do not fill the gaps with clarity, falsehoods and confusion will flood in and vaccine uptake will suffer. Looking beyond fall, routine vaccinations at risk. Routine vaccinations like polio or measles are still strongly recommended and available. Given this meeting, though, I am very concerned about their future for 3 reasons. 1, the ACP chair announced 2 new work groups that will look into the cumulative vaccine schedule, examine the total number of recommended vaccines, timing, and the supposed cumulative effects, and they announced they will revisit vaccines that supposedly have not been reviewed in over 7 years. One target will be the universal implementation of hepatitis B vaccination at birth. 2, policy-based evidence, making the Thimerosal conversation made it clear that this committee had come to a conclusion and then sought evidence to support it. 3, the number of falsehoods flagged was staggering. This suggests that discussions are not robust and are not anchored in the latest best evidence. Bottom line, the science is strong. Vaccines work, save lives, and are very safe. You will have fall vaccines this fall. COVID-19 details are still a big question. This week, the ACIP meeting made one thing clear: Americans are not just fighting viruses this fall, but also confusion and coordinated doubt. Americans deserve a unified health system that steps up with courage to deliver facts, access, and choice, protecting what matters most: lives. Love, Your Local Epidemiologist. YLE. Cat's corner strategy with Tiger and Leone. Saying the quiet part out loud. Roar. Hi, I am Tiger. Our human asked us to get up from our naps and start Cat's corner strategy with Tiger and Leone. She gave us a list of internet allies, which we will post for her here.
Hi, I am Leone. It is better for your mental fitness to go to these websites than to go to bro sites for advice. Substack letters from an American. Heather Cox Richardson. Substack Your Local Epidemiologist. The Midas Touch. The Guardian. The New York Times.
One introduction. Rosette view. The United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only for home building and furniture building. For just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions. Yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry, and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable, wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree. But it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen, and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut down and burn tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lung, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom, the Eco Design Wood Stove International. Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. Rosepview purple air PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.